Now let's talk about some medicines as well. So what I've got here on the board are kind of your classic drugs that are used by doctors today to treat diabetes. And so you can see sulfonylurea drugs here, classic medications. Well, this class of medication depletes CoQ10. Why is that important? Because CoQ10 deficiency reduces the body's ability to process carbohydrate, so glucose. One of the ways we make energy effectively is we take glucose from the food that we eat and we run it through these different cellular mechanisms that convert that glucose into energy in the body, also known as ATP. Well, the rate limiting step for energy production by your body is CoQ10. And so if you think this through a little bit, you know, if you have diabetes or your doctor says you have prediabetes and now they're wanting to prescribe different medications for it, if those medications interfere with your body's ability to generate energy, how much do you think you're going to feel like exercising? How well are you going to break down glucose from the food that you eat? So what happens is people become more tired, they exercise less, that affects their blood sugar, but then they also biochemically can't break their glucose down effectively. That elevates their blood sugar. And ultimately, the drug gives you kind of a temporary transient change effect, but over time, it actually contributes to or leads to the very type of disease or outcome that your doctor's saying he's trying to prevent with you. We see the same thing happen with metformin. One of the reasons I'm not a fan of this drug, and there's a lot of doctors online right now talking about using this as an anti-aging medicine that everybody should be taking because of its anti-aging effects. But if you understand the biochemical mechanism of side effects of metformin, which is that it depletes CoQ10, vitamin B12, and folate, and here in just a minute we'll talk specifically about these micronutrients, B12 and folate, and you understand that when you inhibit these nutrients, you actually cause an increase over time in blood glucose. So not good. And then you have this newer class of medicines, the ones people are going crazy over, you know, especially this one here, this Ozempic. Everybody's talking about this one now as a weight loss aid. But look what it does. Slows down gastric emptying, so it affects how you can poop, right? The other thing that it does is it can inflame your pancreas. Now, what is the organ that controls blood sugar? It's the pancreas. The beta cells in the pancreas are responsible for making insulin. So if you're taking a medicine that causes inflammation to your pancreas, how long do you think that's going to play out before you start having an impact or an effect here? You know, with medicine, there's always a side effect. There's always a price to pay. You know, it's like you rob Peter to pay Paul. There's always going to be a later price to pay. And pancreatitis is one of the potential side effects of being on these GLP-1 receptor agonists. And then general malnutrition, because one of the side effects too for a lot of people that take this stuff is diarrhea. And that diarrhea can cause malnutrition. It can cause malabsorption, malnutrition of micronutrients. And micronutrients are a critical component to regulating blood sugar, which again, we'll talk about that here in just a second. Now, there are other medications that I want to point out. So these are just the meds. The irony here is, again, these are the medicines that doctors use to control blood sugar for people who aren't controlling their own. But there are a lot of other medications that get used very commonly. And one of the class of medicines is called diuretics. Of course, diuretics deplete B vitamins, particularly vitamin B1, but also deplete CoQ10, magnesium, and calcium, which are implicated. All of these are implicated when you don't have adequate quantities of these nutrients. They're implicated in raising or elevating your blood sugar because they impact how your body can process it. So diuretics play a major role. And again, this is a class of medicines that are commonly used. Furosemide is a diuretic. The Lasix, for those of you who are taking it, and then hydrochlorothiazide is another very commonly prescribed diuretic. So you have to be aware of these classes of medicines that can also impact your micronutrition that subsequently would cause your blood sugar to go up. But one of the other big ones is antibiotic. your microbiome, right? So in causing a deprivation of your microbiome, so impact on your microbiome, understand that one of the things your microbiome does is it helps you to regulate sugar, helps regulate blood glucose. And one of the ways it does that is the actual bacteria that live in your GI tract, many of them help you make B vitamins. And so when you decimate your microbiome on a regular basis with repetitive use of antibiotics, you actually can deprive yourself of the very B vitamins necessary to control your blood sugar. The theory is that this is one of the reasons why farm animals get so fat so fast, is that broad use of antibiotics. As a matter of fact, a lot of farmers want to use the antibiotics to fatten their animals up quickly so that they can take them to market and sell them for more money. You know, humans aren't any different in that regard. If you're chronically using an antibiotic, you can chronically create problems, again, in your B vitamins. I wanted to show you this. There are a number of different studies that have been published on antibiotics. Use of antibiotics and risk of type 2 diabetes, overweight, and obesity. The cardiovascular risk in young Finnish study. Okay, so the results of this study show that prior exposure to systemic antibiotics was associated with increased risk of the incidence of type 2 diabetes in more than 25,000 participants. So this is a pretty big study. This isn't a small-scale study. Furthermore, prior exposure to antibiotics was also associated with being overweight and obesity. Now, if you come down here, 4 previous studies, so this research study also cited 4 other studies. 4 previous studies have examined the relationship between antibiotic exposure and the subsequent incidence of type 2 diabetes. These reference footnotes are here, so those of you that actually want to go back and look these things up, you know, you can check that study out. You can click on these and go read these other studies. But basically, there have been some major research studies that have found that antibiotics, the more you use them, the greater the risk of the development of diabetes and obesity. Now, in this particular study, you see here the beneficial role of vitamin K supplementation on insulin sensitivity, glucose metabolism, and the reduced risk of type 2 diabetes. This is a review study, a review paper. But what I want to point out here, the reason I'm bringing this up now is because when we use antibiotics, 60% of your vitamin K1 is produced by your microbiome. So your daily need for vitamin K1 can come from food. You can get vitamin K1 from dark green leafy vegetables, are a great source of vitamin K1. But 60%, meaning more than what your diet gives you, comes from your microbiome directly. And when we have a chronic use of antibiotic happening, what are you doing? You're neutralizing your microbiome as an agent to help you with your own nutrition. And so what do we know about vitamin K? Look here. Moreover, several human studies reported the beneficial role of vitamin K supplementation on improving insulin sensitivity and glucose tolerance, preventing insulin resistance and reducing the risk of type 2 diabetes. Both animal and human studies have suggested that vitamin K-dependent protein osteocalcin, regulation of adipokine levels, anti-inflammatory properties, and lipid-lowering effects may mediate the beneficial function of vitamin K in insulin sensitivity and glucose tolerance. So, vitamin K is kind of it's one of the vitamins that gets very little attention. Most of the attention with vitamin K has come along here recently with vitamin K2, but we're talking specifically about vitamin K1, which most people equate vitamin K1 to the blood clotting cascade, but it's very important for helping your body regulate blood glucose. Now, this is a study on the left-hand side. You can see comparative effects of vitamin and mineral supplements in the management of type 2 diabetes in primary care, a systematic review and network meta-analysis of randomized controlled trials. So this was the conglomeration of 170 studies with 14,223 participants, and this is kind of the overview. This is an infographic, if you will, of the overview of this meta-analysis. And here's what they found about specific micronutrients. They found that chromium supplements ranked best in reducing fasting blood glucose levels. And HOMA-IR. HOMA-IR is basically, it's a calculation that doctors do. A lot of lab tests now are reporting a line item on your lab called HOMA-IR, which is just a calculation multiplying your glucose and your insulin. And so anyway, HOMA-IR is not an actual measurement per se. It's a calculation based on your glucose and your insulin. But nonetheless, chromium supplementation was ranked best at reducing fasting blood glucose. We also see vitamin K was most effective in this meta-analysis of reducing hemoglobin A1C, which is the long-term marker for looking at blood sugar. So vitamin K reduced hemoglobin A1C and reduced insulin. And then we have vanadium. Vanadium supplementation ranked best at lowering total cholesterol, although vanadium plays a major role. When you look at it here, plays a major role in improving insulin sensitivity and insulin receptor function. So that's this diagram here. You can see interrelations between essential metal ions and human disease. In this case, vanadium can block PTP and thus restore the signaling pathway. That's this mechanism right here. This is your insulin receptor. This is vanadium. It blocks this substance here. And so it improves the functionality of the insulin receptor. The insulin receptor then sends a message to this doorway in the cell. It's called a GLUT4 door, which is what allows glucose to come into the cell and be converted into its substrates to make energy. So vanadium, very important, although in this meta-analysis, they're talking about vanadium and its role in reducing cholesterol, but also understand it also plays a role in improving insulin receptor functionality. And then we have niacin, which is vitamin B3, most effective at lowering triglycerides, which we talked about a minute ago, but also improving or increasing HDL, which is what doctors like to call the good cholesterol, if you will. And then we have vitamin E, which has been shown to reduce LDL, what doctors like to call bad cholesterol. Now, how many of you have ever gone to your doctor and they said, let's give you some vitamin E to effectively help you with your cholesterol? Raise your hand and let me know if that's ever happened. I always find it interesting. Nobody ever raises their hand because most doctors don't know anything about nutrition, and so they would never even begin to recommend these types of things, even though, as you can see here, this is a major research meta-analysis showing that these things are effective. At any rate, this is a summary. You've got here some additional data on vitamin K1. You can see the study for the first time demonstrated that circulating vitamin K1 was significantly lower in type 2 diabetes patients compared to age-matched control subjects, and that vitamin K1 levels in type 2 diabetes were significantly and inversely associated with fasting glucose and insulin resistance, as well as the HOMA-IR, which is the homeostatic model assessment of insulin resistance, which suggests that boosting plasma vitamin K1 may reduce the fasting glucose and insulin resistance in type 2 diabetes patients. So again, vitamin K, and that, based on this summary, its effect greater than anything else on hemoglobin A1C and insulin regulation. Now, let's move into some of the other micronutrients. So this was a really nice review that was published, and what they wanted to do was just kind of show that how different micronutrients, vitamins, were associated with the ability to help regulate blood sugar and blood glucose. So you can see here with vitamin A deficiency, you've got beta cell loss. So vitamin A is important for beta cell robustness. And there's some research that shows that mothers who are low in vitamin A, their babies don't have as effective beta cell robustness when they're born, which increases their risk for later on developing diabetes. But beta cell loss disruption of metabolic pathways leading to insulin resistance, abnormal glucose metabolism, and type 2 diabetes. So vitamin A deficiency can contribute to blood sugar malfunction. We also know that vitamin A deficiency contributes to type 1 diabetes because of its antioxidant effect and its role in the beta cell configuration. So again, those of you, I always get the request, can you talk more about type 1 diabetes? Well, we're putting a little bit of that in here today. So both type 1 and type 2 diabetes affected by vitamin A deficiency. Then we have some additional here. You can see with vitamin E deficiency, lipid peroxidation. So lipid peroxidation is basically it's where the fats in your body are broken down prematurely and aggressively, leading to inflammation that can increase insulin resistance and abnormal glucose metabolism, contributing to type 2 diabetes. You see here certain diseases like Crohn's, chronic pancreatitis, cholestasis, which is gallbladder problem, and cystic fibrosis. These individuals are all at greater risk for vitamin E deficiency. I would also add celiac disease to that list, those of you with gluten sensitivity, malabsorptions. And then vitamin B6 deficiency. You can see low dietary supplementation, malabsorption, alcoholism, liver, kidney, digestive, and autoimmune disease. Obesity and smoking can all contribute to vitamin B6 deficiency, which disrupts endothelial dysfunction of fat. And that can lead to or contribute to insulin resistance, abnormal glucose metabolism, hence type 2 diabetes. Then we have vitamin D deficiency. And what we talked about earlier was, where do we get that vitamin D? We get it from sunlight exposure, right? So sunlight exposure, very important for vitamin D production. And we have a mass sunlight deficiency going on in our culture right now. But also malabsorption, vegan diets, lack of exercise, systemic inflammation can all deplete vitamin D. And of course, this leads to adiposity, inflammation, leading to insulin resistance and abnormal glucose metabolism. So these micronutrients, these vitamins, minerals are super important. You know, in the problem, how many doctors talk about it? You know, no, I would be willing to bet that none of you watching this, unless you've been to an actual functionally trained, nutritionally trained doctor, none of your primary care doctors or endocrinologists that are treating your blood sugar problems have ever mentioned any of these things. As a matter of fact, if you asked, probably the reality is they've poo-pooed it. They've said, no, that doesn't have anything to do with it. Yeah, it's not important. In this case, vitamin C deficiency, endothelial dysfunction. Remember, vitamin C is very critical for what we talked about earlier, nitric oxide production, which is a vasodilator of blood vessels, helps control blood pressure, helps control inflammation. But again, deficiency, insulin resistance, abnormal glucose metabolism, hence type 2 diabetes. And then we also have folate deficiency, which is vitamin B9. Again, endothelial dysfunction, insulin resistance, abnormal glucose metabolism. And then vitamin B12 deficiency, we say insulin resistance, abnormal glucose metabolism, all for similar reasons. Now, remember what I said earlier? I said that drugs used to control blood sugar, like metformin, cause a reduction in folate and vitamin B12. This is part of what I was referring to earlier. Same thing with antibiotics, right? Antibiotics can cause B vitamin deficiencies, you know, which again can contribute to micronutrient depletions, leading to an increased risk for the development of blood sugar disruption. So we've got a lot going on here. Now, let's check this out on vitamin B1. This was published in the Journal of Endocrinology. So again, when I say your endocrinologists aren't talking to you about this, this is endocrinology medical literature. This isn't, you know, this isn't something they should not be reading, right? So if we look here, thiamine, this is on vitamin B1, which is thiamine. Thiamine is predominantly obtained from the diet, but can be synthesized by gut commensals. So again, what is a gut commensal? This is the bacteria in your microbiome. This is why the antibiotics can be problematic for so many. Now, thiamine deficiency is linked to nerve and cardiovascular disease. Low intracellular levels of thiamine lead to apoptosis, which is the cell dying, as well as oxidative stress, which is a common note in diabetic complications such as retinopathy and nephropathy. Retinopathy means damage to the eyes, nephropathy, damage to the kidneys, and then neurological disease as well. Now you can see here, thiamine is necessary for optimum insulin secretion by pancreatic beta cells. So your pancreas, those beta cells, need thiamine to secrete insulin. Indeed, lack of functional thiamine transporter leads to diabetes in humans, whereas reduced plasma thiamine has been found in patients with diabetes. In addition to its role in beta cell physiology, thiamine deficiency leads to suboptimal activity of key enzymes in carbohydrate metabolism. So if you're trying to break those carbs down and convert them into energy, you need thiamine to do that. Again, this ultimately favors the buildup of glucotoxic intermediates linked to endothelial complications associated with hyperglycemia. So basically what happens is you get glycation. If you've ever heard somebody use the term AGEs, AGEs stands for Advanced Glycation End Products. These are byproducts that are caused by excessive glucose not being properly broken down, and they're very damaging to your proteins. They're very damaging to the vascular tree, hence why they're associated with disease. So you can see here, since the 1940s, thiamine supplementation has been shown to improve glucose tolerance and fasting blood glucose. These findings have been corroborated more recently and extended to an important beneficial effect of thiamine supplementation on vascular health and oxidative stress in the context of hyperglycemia. So, very, very important. Again, thiamine B1 thiamine deficiency causes reduction of glucose tolerance and increased insulin responses. We don't want to be deficient in thiamine. Now, again, one of the biggest ironies of this whole situation is that typically when people have diabetes, most diabetics, statistically speaking, also are being medicated beyond the diabetic medications. They're being medicated for blood pressure problems. They're also being medicated for cholesterol problems. Now, if you're being medicated for blood pressure problems, this is going to lead to a reduction of vitamin B1. It can also lead to a reduction of zinc, which plays a role in insulin production. And if you're taking medicine for cholesterol, of course, that's going to block CoQ10. It's also going to interfere with vitamin D, which we've talked about today as being important for regulation of glucose. So, you know, it's what I'm trying to show you is that if you don't control your blood sugar, the standard of care is you go to your doctor and they're going to do all these things. They're going to control it with drugs, then they're going to control your blood pressure and your cholesterol with drugs, all in the name of reducing your risk of developing problems or complications from these issues. But to do that, they're actually inducing deficiencies of nutrients that cause the very disease that they're trying to help you prevent. So you lose. It's what happens is you lose. It's a trick. You're not really doing anything to improve your outcome. What you're really doing is you're improving in the transient short term. You're improving your lab tests while destroying your health over long periods of time. So don't get caught up in that trap. If your doctor hasn't talked to you about applying stress management control through exercise, through behavior, through diet change, through micronutrient supplementation and testing, then he's on the wrong track, or she. Now, let's look at this one here. The impact of, this one talks about some studies. Basically it's a review article summarizing a number of studies that show that maternal micronutrient problems during pregnancy can actually lead to increased risk of the baby having obesity and diabetes and blood sugar problems. So you can see here, there are a number of trials here summarized, but in the context here, the iron, zinc, and folate supplementation helps to reduce the HOMA-IR, again, which is just a way to measure somebody's insulin resistance, and there reduces the risk of developing type 2 diabetes. In this other study, the low vitamin D levels led to insulin resistance and to reductions in C-peptide. C-peptide is a marker in the blood. So if C-peptide is low, it equals the reduced capacity to secrete insulin from the pancreas. So it's a marker that doctors use to help understand how well is your pancreas making insulin. And then you can see in this study here, low vitamin B12 led to a problem with increased adiposity and insulin resistance. as well as an increase in insulin resistance or HOMA-IR calculations. And then down here, low serum vitamin B12, again, increased HOMA-IR triglycerides as well as increases in homocysteine. Homocysteine is an inflammatory marker that can increase your risk for cardiovascular damage, including diabetes. So these are all, again, these are moms, right? So we're talking about increasing the effect in their offspring. So this is the maternal status. This is the effect on the actual babies. And these are human studies that we're seeing this happen. So you can see this kind of, again, another infographic that these authors produced is maternal micronutrient undernutrition during pregnancy leads to epigenetic alteration in DNA methylation, histone modifications, and regulation by non-coding RNA. All these changes lead to, if we're summarizing here, the potential increased risk for fat deposition, the reduced capacity for lean muscle mass, the reduced functionality of the pancreas, and more oxidative stress and damage for the liver. So all of these things, when you combine them, what does that lead to? It leads to more cesarean sections. And, you know, part of the problem with a cesarean section is how does the baby get inoculated with their microbiome? So when babies are born, part of how their microbiomes are formed, and we've talked about the microbiome today, so hopefully this translates well for you, is when babies are born through cesarean, they're not getting inoculated. And so when they're not getting inoculated, their microbiomes are at a disadvantage when they're born. What is this going to translate to in terms of their overall health risk for blood sugar regulation or blood glucose regulation? So increased cesarean sections as a result of all these types of complications. But then later life, again, for these no longer babies, but later life phenotypic changes means later in life what happens to these babies. Increased body fat, increased glucose, increased insulin resistance, increased glucose tolerance, increases in dyslipidemia, which is elevations of fats in the bloodstream, reduced good cholesterol, HDL, and increases in systolic blood pressure. And then if you look at the adverse outcomes of those side effects, what do we get? We get obesity, prediabetes, diabetes, metabolic syndrome, and cardiovascular disease. So this stuff doesn't even happen you know, with you per se. It happened while you were in your mother, while you were being gestated, basically. And so this is one of the reasons why it's so important for moms to be taking an active role during pregnancy to improve the ability of their children's outcomes to not be overweight, diabetic, and lack of blood sugar controlled.